Hello, everybody. I am staying on the breast topic. Last video I made was on breast health, and this one is for mothers who are nursing. My name is Dr. Blythe Metz-Mändmets, and I am a metaphysician and holistic healing coach. And I nursed for 9 years straight. I nursed through my second pregnancy. I have two kids, and I nursed them both until they were about 4.5 years old. And, people always ask me, like, how did you keep the milk for that long? So this video is about how to keep your milk. So for mothers that are just starting nursing, it can be extremely overwhelming. I gave birth to my second one at Cedars-Sinai Hospital in Beverly Hills, and they did not have lactation consultants. Can you believe that? Cedars-Sinai in Beverly Hills in 2019. Unbelievable. But it was a disaster that I was even in a hospital. I would have much rather had a home birth as I intended, but I had to have a C-section. So what I glean most often from mothers who are nursing is that they're taking it as an opportunity. Sometimes, not always. I don't want to like put it out there that like this is what everyone's doing. By no means. But this video is about giving you some tips to make sure that you have plenty of milk. These are suggestions that will help you make sure you're lactating abundantly, which will be really nice for you and your babe. So number one is to not be on your phone when you're nursing. I know the temptation, it's like the stillness, and so many people just like want to go to their phone. First of all, the phone should be nowhere near your baby, especially not anywhere near your baby's head. The phone is putting off Wi-Fi and Bluetooth, which are all electromagnetic frequencies. Our cells communicate with each other electromagnetically. We don't know what living in this soup of electromagnetic chaos is doing to us. We certainly know that we see the cancer rates going up. We do see that. But we can certainly protect ourselves in many ways. And one way is to definitely not wear your phone in your bra. I see women do that. Worst place ever. No. I use a bandolier strap. It hangs off the side of my hip, which is, next to no organs. So it's like, and like a little patty cushy hip. So it's a safer place than next to my breast, my heart, anywhere on my front or back body. And you definitely don't want your phone anywhere near your baby, and certainly not near your baby's head. Something else that's really important about that is you don't want your babies growing up just seeing their mother on their phone all the time, right? That you don't want them, especially as a baby, seeing the images of you just like, on your phone, looking at your phone all the time, because that's implanting them this, we're humans. We just look at our phone. And believe me, when they get older, it's going to be hard enough to balance the screen time in our culture. So don't start off by just showing them, their mother on the phone all the time. Use the time to meditate. Use the time to just stare at your child and just feel the love. Like, allow yourself. This is so healing. And it's so sad that so many mothers miss this opportunity because they just haven't been taught to meditate while they're nursing. No one's like told them or woken them up to that amazing opportunity, is that just be still with your baby, especially if it's your first one. I know that's harder when it's your second, your third, your fourth, or thereafter, but you know how important it is to just, even when it is your second, your third, to just, when you're nursing, to let it be that you're just nursing, that you're not on your phone, that you're not doing something else. Let it be that you're just nursing, and you will have more milk. I mean, I talk to moms that are like, yeah, I'm writing while my kid's nursing, and I'm, doing the dishes while they're nursing in the wrap. And I'm like, yeah, okay. But if you're struggling to produce milk, you want to make sure that you're relaxed when you're nursing, that you're not doing anything else, because that signals to the body, this is what I'm doing and I'm producing more of it. It's almost like when you're multitasking nursing, the body is like, oh, do I prioritize this or do I prioritize whatever else you're doing? Let your body prioritize just nursing, because it's, what is it, 15 minutes, 20 minutes? Really use that time to meditate, to vision, to just gaze at your baby and just love, just allow yourself to feel that oxytocin. See, that's the thing too. When you look at your baby and your baby looks at you, that oxytocin in your system, that's the chemicals. Not only the chemicals that regenerate you, the chemicals that make you happy, they're the chemicals that will help your body produce milk. So yes, you can, drink the raspberry leaf tea, and you should, and the mother's milk tea. All of those things are really great, and making sure you have an excellent diet, lots of greens. All of those things are wonderful. But the most important thing is that you're connecting with your baby when you're nursing, and that you're not on your phone. So for women that are pumping at work, bless your heart. You're a trooper. I love you. That's such an awesome commitment you're making to your kid. And I know it's hard. I know you're sacrificing for it. You want to be looking at, you can have your phone to look at pictures, put it off, don't touch it, because you don't want the electromagnetic chaos to be touching your skin. If you can, play one of the memory videos that your phone automatically makes, and look at your baby while you're pumping. This is going to help your body produce the milk. And if you don't want to have, it's good to just not even be on your phone at all when you're pumping. And in that case, just close your eyes and visualize your baby. Think about the snuggles, think about the love, hold your baby in your heart. When you visualize your baby, when you connect to your baby's energy, when you're not with your baby, that's something. That's a real connect. You're really doing something there. There's really an energetic connection that's happening between the two of you, and your baby will feel it too. Your baby will feel, oh, mommy's connecting with me. Because frankly, it's really hard for the babies to be away from their mothers when their mothers work. It is hard. I know we just want to be like, oh no, it's fine. They love their nanny. They love their daycare, whatever. Maybe. But they love their mommy more. And I'm not shaming you, of course not. People have their own circumstances. But just know that when you think of your baby when you're not together, that matters, and that your baby feels it too. And your baby loves you so much. So remember how much your baby loves you when you're pumping. And that will help produce more milk. Because I know you can pump for 20 minutes and get like 1 ounce. And it's like, what? So you want to be able to pump for 20 minutes and get 4 or 5 ounces. And that will happen if you're relaxed and if you put that oxytocin in your system by thinking about your baby and coming from that place of not, like, if you're at work and you're pumping and you're like looking at Instagram on your phone about nothing with your baby, like, of course your body's not going to be able to produce the amount of milk that it would if you were really just in reverence for what's happening, for the fact that your body is producing the most amazing nectar that your baby needs. And it's such a wonderful thing. So God bless you. I'm here for you. Please look at the other videos on my channel. They will help you stay happy and connected to your highest happy self. I am here for you. Until we meet again, don't forget to eat and drink your greens.